Hey everyone, and welcome back to the channel. Today's topic might not be the most glamorous, but it's incredibly important: colon cancer. Early detection is key, so let's talk about the signs, symptoms, and most importantly, how to prevent it. Colon cancer. What is colon cancer? Colon cancer is when abnormal cells grow in the lining of your colon. These cells can form tumors and spread to other parts of your body if left untreated. Now, colon cancer often doesn't cause any symptoms in the early stages, but as it progresses, you might experience some of these. 1. A change in bowel habits. This could be constipation, diarrhea, or a narrower stool than usual, lasting for weeks. 2. Rectal bleeding. This can appear as bright red blood in the stool or on toilet paper. 3. Blood in the stool. This might make your stool look dark brown or black. 4. Persistent abdominal pain or cramping. This could be a dull ache or sharp pain in your belly. 5. Unexplained weight loss. Losing weight without trying can be a sign of several conditions, including colon cancer. 6. A feeling of incomplete bowel emptying. Even after going to the bathroom, you might feel like you haven't fully emptied your bowels. 7. Weakness and fatigue. Feeling tired all the time can be a symptom of many things, but it's worth mentioning to your doctor. 8. Iron deficiency anemia. This can make you feel tired and pale. It can be caused by blood loss in the colon. See a doctor if you experience any of these for more than a few weeks. Remember, these symptoms can also be caused by other conditions. However, if you experience any of them for more than a few weeks, it's important to see your doctor to get checked out. Early detection is crucial for successful treatment. The good news is there are ways to help prevent colon cancer. Here are some key strategies. 1. Maintain a healthy weight. Obesity is a risk factor for colon cancer. Aim for a healthy weight through a balanced diet and regular exercise. 2. Eat a balanced diet. Focus on fruits, vegetables, and whole grains. Limit red meat and processed meats. 3. Stay active. Aim for at least 30 minutes of moderate intensity exercise most days of the week. 4. Limit alcohol. Heavy alcohol consumption can increase your risk of colon cancer. 5. Quit smoking. Smoking is a major risk factor for many cancers, including colon cancer. 6. Get screened. This is the most important step. Talk to your doctor about when to start regular colon cancer screenings. This video is for informational purposes only and should not be a substitute for professional medical advice. Always consult your doctor about any health concerns.